Thank you all for joining the Tigers for Inclusion and Diversity in Ethics Conference here with the College of Behavioral Health and Social Science at Clemson University. My name is Dr. Tracy Fasolino. I'm an associate professor in the School of Nursing, and I'm excited that you're joining us today. And I have the esteemed pleasure of introducing our guest speaker. Just a little bit about her. Although Dr. Raja's interest in building and breaking began with the material, such as machines, roads, buildings, and bridges, the majority of her career has focused on the building and breaking of analysis and theories. Her motivation? To support systematic change that improves health and well-being for whole communities. Trained as a civil engineer and planner, Dr. Samina Raja is professor of urban and regional planning and Associate Dean of Research and Inclusion in the School of Architecture and Planning, University of Buffalo, the State University of New York. She is a giant in the field of food systems planning. In fact, the term didn't exist until she began her PhD studies at the University of Wisconsin-Madison. Dr. Raja reflects upon her advisors with great respect and gratitude. She credits her PhD as the most transformational experience of her life. Her advisors shepherded her through, giving her the skills she uses to this day. Professor Kaufman, the man who authored the earliest code of ethics for all planners in the United States, taught her how to ask bigger picture questions, while Dr. Huddleston gave her the tools to answer them. With her multidisciplinary training in engineering and planning and an emphasis on public finance, as well as her upbringing, Dr. Raja thinks about food research very differently than many other researchers in the field. In addition to arguing for food equality with a normative stance, it's the right thing to do, she uses economic analysis to argue for food system transformation. Dean Hosfeld is quoted as saying, Dr. Raja is a leading expert on linking community food systems and community economic development through planning. I have known her and followed her work for over a decade and have been fortunate to have her speak at now 3 conferences over the years. Her expertise on, quote, planning communities as if people eat is ever more salient given the pandemic and the struggles families and communities face daily. We are very fortunate to have her here with us today. And thank you, Dr. Raja, for taking time out of your incredibly busy schedule to share with us your speech on the ethical issues and responses to food equalities. I will now turn the presentation over to you.
Thank you very much for that wonderful introduction. I hope my audio is clear. It is with great pleasure that I join all of you for this conference. What an important topic. When I received this invitation, I have to say, I was delighted and honored. I have always enjoyed and appreciated the leadership of Dean Hosfeld and was grateful to be invited to join other distinguished guests on this important topic. Begin by thanking all the organizers, including Dr. Fasolino, as well as the students who are supporting and the organizers behind the scene. Thank you for having me. I will begin by checking to make sure my slides are advancing. I'll begin by telling a little bit about whose work you're going to hear about in my comments today. And then I'm going to tell a story, the story before the pandemic, the story now, which simply reminds us that the pandemic is a portal. It's a challenge, but it's really revealing some things that were already in front of us. And then I will talk about some ways forward and share some resources. As I go through our time together, I will begin by first acknowledging that this conference, which encourages us to think about ethical challenges and responses, is really personally meaningful because when I started as a graduate student in the United States, the first class that I took, in fact, as a graduate student was a class on ethics. As some people may not know, I lived and trained outside of the United States as a civil engineer and an urban planner, and was often struck by how questions of ethics were the last to be raised. I say that to say that I am grateful that Clemson is beginning and raising these questions as central to all of the disciplines that are engaging in today's conference. So congratulations, and let me move forward. The work that you're going to hear about is not just work by me. It is work that represents an entire team, and that is the Food Systems Planning and Healthy Communities Lab, gathered here in spring 2020 with a scrawling message in the back. Little did we know that that would probably be the last meeting that we would have in person for a while. But believe me, the team is still at it, looking slightly different. A special shout out to Eric Wusigis, whose name is on the bottom right, who provided some of the data support that you will hear about today. So our group collectively, whose work I'm presenting here, focuses on the role of policy, but specifically on the role of people in policy and how do we create communities that are equitable and sustainable. It just so happens we come to the question of ethics through the work, the domain of food systems. We view food system as a lever for broader social transformation. I provide this context so that you can understand my comments about the pandemic as a portal. So the Food Lab, the comments that I will share are drawn from experiences in the city of Buffalo, but also more broadly. We work primarily at subnational scale in the United States, but also in other parts of the world, primarily in Global South. And I will say that by Global South, for us, it doesn't mean a geography, it means a set of power relationships where communities are left out of conversations, including in the context of COVID. So the story before is a story not about the pandemic, but I'm going to tell it so that we can revisit what are the new sorts of ethical questions that are raised because of COVID. So the story before, let me set the stage nationally. As a profession, urban and regional planning, which I represent, has always claimed, it's a relatively young profession, has claimed that it is about creating convenient, equitable, healthful places for present and future generations. As Dr. Fasolino said, my advisor, Jerry Kaufman, was one of the earliest scholars to raise the question of ethical practice in planning. What does that mean? So if this is the aspiration of planning, food, which is something that is central to our very existence, how does that fit into this question of creating equitable places? So before I answer that question, I just want to make sure we're on the same page. I might use the term food system as I'm going through my comments. And by that, I simply mean all the sets of activities that enable food to move from farm to plate. And in the planning world, those sorts of activities that are tied to the food system are touched by planning decisions. Planners may know it, planners may not admit it, planners may not recognize it, but planners have always impacted food production, how food gets to us. So anytime a transportation network is made, we are making a choice. Every time we decide to convert farmland into housing, we're making a food choice. So food system sectors are always impacted by planning. This is not new as a result of COVID. Remember that this is the story before. So in city and regional planning, or if you might call urban planning, there's all kinds of stuff, comprehensive plans, regulations and ordinances, zoning codes, public finance, all kinds of stuff that impacts everything that happens to our food system. Again, this is not new. This has been happening since the very existence of the profession. So in 2014, keeping that backdrop in mind, in 2014, a group of us asked planners around the country, what do you think about food? And the survey went out across the country. And what we learned is that very few, 1%, said food systems planning is a top priority. I choose to present this somewhat dated information so that you have context about what the world was like before COVID hit. So 1% of urban planners who work for local governments across the United States, as represented in this sample, which was roughly 1,000 responses, said that food systems planning is a top priority. The rest, not so much. So that's the national landscape. When you dig a little bit deeper, what we learned through that national survey was that there was interest, but people reported, again, local governments and planners reported there's not enough funding. When they did do something, it was about regulation, not investment. So regulation was the dominant way that city governments, town governments engaged in food systems. For example, zoning, telling people you can have this particular land use or you cannot have this land use. But of course, planners have all kinds of tools at their disposal, but they seemed not to use them to strengthen food systems, to tackle this question of food inequity, if you will. Most recently, in literally 2020, tail end of 2020, a colleague at Johns Hopkins University, Dr. Eli Mui, published a national analysis of comprehensive plans that are prepared at the regional scale. So she looked at plans from 2018 to 2020 and reported in this article that was just published in Journal of American Planning Association that equity still remains somewhat overlooked. So yes, food is starting to come center stage, but equity remains kind of not central to what planners are doing. So that's the story pre-COVID. So let's come to pre-COVID from the national scale, zooming into one of my favorite parts of the country, which is Buffalo, New York. I invite everybody from Clemson to come visit anytime. We have much better weather in Buffalo. It's not a joke. But let's come to Buffalo, get closer to the ground. For those of you who have never had the pleasure of coming to the Rust Belt City, we are on the shores of the Great Lakes, and we are somewhat of a hidden secret. We are the second largest city in New York State. People sometimes don't realize this. So I'm going to use Buffalo as an example to illustrate why what the kinds of ethical questions that are raised by COVID are frankly not new. So the city of Buffalo is about 250,000 people. And on the right side is a map of income distribution in the city. And as I go through my story from before COVID, you will notice some patterns, and this map will start looking quite familiar to you as I go through. So the city is increasingly diverse. It's a historic city. It was on the Underground Railroad as Black Americans, enslaved Americans sought freedom in Canada. They would go through the city of Buffalo. Today, our median household income is about $35,000 per year, and about 30% of people live in poverty. And the income distribution patterns, if you look on the map, the lighter color is lower income, and it tends to be concentrated on the east side of the city. A comment, an observation that will come up as I talk about COVID shortly. So that's the city of Buffalo. As we move forward in Buffalo, apologies, my slides are moving slightly slowly. One of the things that you will see on the slide, there's a purple mark up and down the map, and that is what is called in the city Main Street. Main Street is the proverbial dividing line by income and dividing line across racial categories that reflects disinvestments that have existed for many decades. So moving forward, we're still in the story before, and here are the racial distribution patterns, again, pre-COVID, on the east side of the city, underrepresented minorities, Black families, Black households, historically Black neighborhood is on the east side, and you have a growing immigrant neighborhood somewhat to the west side of the city. And as we move forward, if you looked at the food situation, which raises a lot of ethical challenges, if you went to the predominantly white neighborhoods, you would see a particular prevalence of supermarkets and grocery stores. This is data from 2008. The year is on top of your slide. And then if you went to predominantly Black neighborhoods, that's what would happen to the prevalence of supermarkets and grocery stores. And I put this up with a clarification. This is data that is adjusted for wealth of the neighborhoods. So I'm not here showing you results comparing poor Black neighborhoods and wealthy white neighborhoods. I'm actually comparing similar sized wealth in terms of wealth neighborhoods and illustrating the racial disparity. But if you look at other kinds of stores like convenience stores that do not actually carry good food, the prevalence changes. This is a story that we've seen repeated in other parts of the country as well. But again, this is 2008. So over this time, pre-COVID, you have on top of the slide a lot of activity by community organizations that is in green. And I'll walk you through some of the events in the city that draw our attention to particular ethical questions that got expanded in post-COVID. On the top, you are seeing that people, community organizations, civic organizations are organizing a food policy summit. Organizations are establishing urban farms, etc. And fast forward to 2018, 2019, you're seeing the emergence of a Black, Brown, Indigenous-led coalition called the Buffalo Food Equity Network that was formed, again, before COVID. Looking at all the work that is done by community organizations, a foundation invested $1 million in 13 food organizations to continue to build food equity in the city. On the bottom, in the orange, are policy actions that the city government or county government enacted in response, frankly, to calls by community organizations. And I think what's important here to remember is that a lot of work on the ground in the neighborhoods preceded the policy response from the city. So here are some pictures to give you a sense of our city. This is an urban farm. It no longer looks like this because, again, I'm showing you almost 10, 15 years historic pictures of the west side. This is Massachusetts Avenue Project that runs a youth program and engages in a lot of food justice activities by empowering youth. They train youth in food business. Their products show up in grocery stores. They do policy organizing. This is 2011. And more recently, we've seen the emergence of a Black-led food co-op that focuses on ownership. So the conversation in the city of Buffalo is very much about tackling food apartheid rather than tackling hunger. We have the city of Buffalo is a refugee resettlement region. So West Side Bazaar, whose kitchen you are looking at, is an incubator space for refugees to start their food businesses, bring richness into our city. And we have refugees and immigrants with a history of farming in their own host communities, bringing that richness to our city and region. This is the Somali Bantu farm, which is now a bigger collective. And as I mentioned, many of the individuals and organizations that work on food have launched a Black-led, Brown-led caucus space for food justice work. And this is a picture from actually our Juneteenth festival in 2019, which was really the idea of Jamie Swigert, who's in the top right corner. She's kind of the visionary. And we have an intergenerational space. On the left side is Ms. Della Miller, who's been a leader in the food space years before I even arrived or knew what food justice meant. So all that to say, because of these 13 organizations and the work on the ground, a lot has shifted. Again, we're still in a pre-COVID world. So a few years ago, my lab was asked to map out where there is an opportunity for change. And so on the left side of the screen, what you're looking at is a map that illustrates where are the communities that have been continuously historically marginalized and where can we direct investment. And that map was partially guiding the $1 million investment that I mentioned earlier. And on the right side, what you're seeing is the work of those 13 organizations peppered around the city in these areas to make a real difference through a variety of activities, ranging from growing food to distributing food, very much an emphasis on ownership over the food system for Black and Brown people, rather than only moving food to the hungry. And this will come back as I go through my comments shortly. So that's the story before of Buffalo. Now we come fast forward and COVID arrives, as we all know well. And what the pandemic does is it changes conversation in some ways. What we see in the city of Buffalo, and I suspect that this is no different for all of you, where you are, we start noticing that distribution of comorbidities have a spatial pattern. Recall that I talked about all the ways in which disinvestment has happened on the east side of Buffalo. And of course, when we look at where testing is happening, where high-risk clusters are, we start noticing somewhat similar patterns. So this is a map that you have seen before, pre-COVID. But where the square is the area that got reported as having very high prevalence of COVID in the city. Fortunately, we have a task force led by leaders in the Black community that insisted on testing and rapid response to COVID. Otherwise, my hunch is, and in fact, they have said that conditions on the east side would have been much worse. But to give you a little bit more sense of the situation, the east side is also an area where vehicle ownership is low. What that means is during time of COVID, especially for seniors in the Black community who were not able to leave, where the risk of infection was high, comorbidities were high, you had an accumulation of challenges that really were building on past challenges. So sometimes people say that COVID is treating everybody the same. It's a disease that impacts everybody, but really not everybody has the prior starting place. The impact on everybody, the outcome is actually quite different and spatially varies based on prior disinvestment in those communities. So here's some data to put a sharper point on it. You are seeing in those bars the prevalence of COVID in the same city of Buffalo. So underlying is the data on vehicle ownership that I showed you earlier, but on top of it, the brown bars that you are seeing is reports of COVID clusters in the city. Just a methodological clarification, because I know there are students listening. The COVID data is based on zip codes on the dotted lines, whereas the vehicular ownership data is based on census tracts. So you've got this amplification of past challenges that are being, that we are seeing are having a negative effect today, post-COVID. And then because of COVID, we notice another thing. Suddenly language transforms. So people in Buffalo Food Equity Network, the Black, Brown, network, indigenous network of people who have been working on food equity and food justice have been calling for a more equitable food system for a long time. I showed you a long timeline. But suddenly, United States and all of us started calling food workers as frontline workers. There's a newspaper article from New York State Governor. Cuomo calls for hazard pay for frontline workers, including grocery staffers. I found this kind of a interesting transformation of how, when everybody is quote unquote impacted, people who we depended on all along suddenly emerged as frontline workers. And in the public's mind, there was a growing awareness of food system, food supply chain. People were rushing to buy food. People were speculating whether there would be milk or not on the shelves, etc. And suddenly we also saw an interest in buying local as people were shut in. But again, whichever city you were in, and certainly this was the case in Buffalo, if you were a person of resources, you could do Instacart order. If you were somebody who could order food in, the privileges that pre-existed allowed you to make use of the food environment just the way you could even before. And the burdens that existed before were just enhanced even more. So in some ways, yes, public conversation was about food, but it was really, COVID was revealing what was already broken in our food system. So as a response, of course, the Buffalo Food Equity Network and other leaders in the city of Buffalo, because of all the relational work they had done before, gathered very quickly. And the blue dot is around the time when they gathered, COVID hit, and they launched what became known as Seeding Resilience. This happened literally within weeks, and 80 plus members from the Black leadership, immigrant leadership gathered, as well as white allies from across the city that work in the food space to develop an acute and response to COVID, but also in a way that would be resilient in the long term. So Seeding Resilience was launched very quickly. And the point of Seeding Resilience was to move food around for people who wouldn't have vehicles, who were elderly, who would be in neighborhoods that are historically disenfranchised, who wouldn't have a grocery store next to them. All the cumulative burdens that I described, Seeding Resilience was focused on that. I am trying to make my slide go forward. Okay, so in addition to the relational infrastructure that groups depended on, rapid mobilization happened. Phone calls, texts, flurries of texts, but they only happened because of those pre-existing relationships. And I'm making a list of organizations here: Buffalo Food Equity Network, Grassroots Gardens, a lot of different organizations that gathered, including my lab, and decided on what kind of response they would have. So they talked about timely and affordable distribution of food, increasing production on existing farms, gardens, front yard, backyard gardens. Remember, this was spring, and to do it in a way that we would be able to create jobs and employment. And perhaps one of the most exciting outcomes of that formation of that coalition, that relational infrastructure and rapid mobilization, was one of the elders in the city of Buffalo, Ms. Gail Wells, launched something called Freedom Gardens. These were backyard, front yard gardens that were really focused on directing agency and opportunity into our historically Black neighborhoods. I think she put out a call for 50 gardens, and we had a wait list that was much longer. And she, working with all the partners, were able to put in 50 gardens at pretty short order. So the coalition was able to do this, and then they also aggregated resources. They had data calls weekly initially, then monthly. These are still happening. They're open to the public. Anybody can hop on. And they asked the food lab for aggregated data of where food would be throughout the city. So unlike how the way typical research happens, our lab had to respond super fast, put all our data on a Google map so that people could find where the nearest school was that was giving out food, where were the retail stores, etc., where were the free pantries. So we had to put that data out super fast. So what was noticeable to me was that people in the community were talking both about short-term deployment, but also what our future might look like. So there was very clear understanding that there is nothing like normalcy, because even before COVID, things were not normal. So that's a picture of Ms. Gale with her Freedom Garden beds from one of our newspapers in the city. So there was an intent that the future has to look different. And that gives you a map showing where Freedom Gardens were established last year following COVID. So I have told a two-part story. I've talked about the relationships that existed prior to COVID. I've talked about the rapid deployment that happened after COVID. What you will notice is that I haven't touched much on what are the ways in which city government responded? What are the ways in which our food pantries responded, which did an amazing job. So we are very lucky to have a pretty terrific infrastructure with food pantries in the region. So I didn't touch on that too much. And that was a little bit intentional because I want to talk about a way forward. And does the way forward, is it about an acute response to a pandemic, or is it about how we think about our long-term equitable future? Is the ethical choice to simply resolve and get the food to a person now, or to set the stage where in the future our communities and our households and our Black, Brown, and Indigenous people have ownership over the food system, so they do not have to depend on those short-term measures. So that's the key, I think, question for us that we have to wrestle with. What are the systems and structures we're creating in the wake of the pandemic that do not take us back to what some might say we need to get back to normal? I would argue we actually don't want to go back to normal. So what are those key ethical challenges and tensions? I'm gonna close shortly so that we have a chance to have a conversation. The first is, I think the pandemic response from across the country, but certainly in Buffalo, can no longer be viewed as the domain of a single organization, single sector. Certainly Buffalo Food Equity Network members couldn't do it by themselves. City government cannot do it by itself. Nobody can really do it by itself. So we need a large network. And yet as that network gets bigger, logistics, coordination, communication gets harder. So New York City, for example, had somebody who was in charge of the acute response to COVID. But as soon as you centralize that and scale up the logistics, coordination, communication, you might actually hit the wrong people. So scale goes up and you lose connection with where the food is actually going. So acute response runs into that challenge. Then in the wake of COVID, service provision was and continues to be privileged over Black, Brown, and Indigenous agency and ownership. Is the lesson that we ought to, ethical lesson about let's provide better service, or we provide better agency and ownership? How do we lift that up? That's the second dilemma, tension. The third is that public policy at higher levels of government, federal government, global decisions, inter-country trade agreements about how grain flows, decimates local communities, decimates what happens on the east side of Buffalo. And then you have this code word, resilience. Community is resilience, community is doing its job, which is code word for you deal with problems that somebody else created. I think that needs to be unpacked as an ethical question. Then the fourth one is that as all of the pandemic was happening, the more fundamental question about the very basis of freedom and well-being and who's responsible for that was being threatened. Along with COVID, we also see a racial uprising in the country. But in the local government, say in the city of Buffalo, but city of Buffalo is not atypical, this is true for local governments across the country, police expenditure, not food, is a bigger budget item, for example. Do we really need local government that has a bigger budget item for food than police? I would say that ethical questions are demanding that we reimagine what does freedom and well-being look like, and what does public policy for freedom and well-being look like. The fifth, I'm still pondering, not a solution here. The tension is that the nature of evidence was challenged, is challenged. We have more data, but less clarity about the direction in which we need to make decisions, including in the food world. So those are the 5 challenges or questions that come to my mind that I think COVID has amplified for us, and ones certainly that I think about myself quite a lot. So going forward, I think about some possibilities. Being somebody who I find it difficult when scholars only talk about challenges but not possibilities. These are not solutions, they're possibilities that we have to think about. For urban planning as a profession in local governments and functional democracies, I think we have to rethink food as an essential infrastructure. We can't decide grocery store workers are essential workers only when there is a pandemic. I think the pandemic has to serve as a portal to remind us that's who food workers are, that's who farmers are, that's who farm labor is. They were always essential infrastructure. And then we have to really focus on investments. Public and civic investments have to happen by understanding pre-existing systemic inequities, especially as experienced by Black people, drawing on Buffalo's example, but I think the same is true across the country. The third is that we ought to collectively, societally, theoretically, from a policy perspective, understand the power of community networks. That along with scaling up solutions, we have to understand community networks as a relational infrastructure. And then we can't do any of this. We can't come up with the right solutions. We can't come up with the prescriptions unless historically marginalized communities are in the driving seat. They are the ones shaping and driving public policy. So those are 4 possibilities that I think about in response to the ethical questions, tensions I raised. And I look forward to some of you asking questions and responding and sharing your ideas of how we may actually collectively move forward. Thank you for listening. I know Zoom is not where you want to be. I appreciate you all. Back to you.
Thank you, Dr. Raja. You sure left us with quite a bit to discuss here and think about. I'm going to bring our change organization students on now to start fielding questions from our audience. For those of you who have some questions that you would like to pose, if you will kindly put them in the chat box, and Ellen and Sergio will be able to navigate through those. I believe we might have 1 or 2 questions queued up and ready. So I'll turn it over to the change organization students. I appreciate them being here.
Hi there, Dr. Raja. I just want to say thank you again for taking time out of your day to talk to us about this. This is definitely an important subject that needs to be discussed more. And with the end of the pandemic in sight, well, it seems to be in sight, these problems sure won't go anytime soon. But I wanted to ask, what would you tell someone who wanted to help bring food equity to underrepresented areas in their community, but doesn't even know where to start? And I'm thinking along the lines of the Clemson area or areas in South Carolina that are underrepresented.
It's a great question. The amazing thing is that in every city, every town around Clemson, there are always organizations or individual leaders who've been thinking about food for a very long time. I would say, especially if we are thinking about students or faculty or staff, anybody, it really is important to ask around who are the people that have been doing food work for a long time. I think one of the mistakes, certainly that includes me, is not learning about the history of a place. Who were the people that were doing food work before we called it food work? In the city of Buffalo, Miss Gale, for example, she was working on a food breakfast program in the I want to get the decade right, 70s. And I met her, a few years ago after I came to Buffalo. So my suggestion is to really ask around. And so who would you go about asking around? I find it really helpful to pick up the phone and call some faith-based leaders. I find it helpful to call local newspapers. And if you're in a university setting, you can always use your Clemson library system to do some literature search and see what was going on. And then I also find unions and student organizations to be really insightful. I hope that's a place that you can start. It's a lot of ideas.
Thank you.
So I also really, really appreciated this talk. I'm a political science major, and so a lot of this has focused on things that I think are interconnected within our society and that absolutely need to be worked on. So my question is, I see an interconnection between gentrification and food deserts. Do you see this as well?
Mm-hmm. I'm going to first say that you will notice that I did not say the phrase food deserts. I have to give a shout out to a linguist colleague who said, if you want the world to forget a word, don't say it. So I was trying my hardest to make the word disappear, but since you raised it, I will tackle it. You are absolutely right, Helen. I think one of the challenges with gentrification is that any time that somebody tries to improve the food environment, let me use that phrase, or reduce food apartheid, if you're not intentional about what you're doing, it will make things better for people who already have resources. So we know that as soon as a grocery store opens or a community garden shows up, that sometimes in its wake, property values will go up, stable neighborhoods will be gentrified. So you are absolutely right. So there's only one protection against that. I mean, there may be many, but one that I think we have to think about is that we have to engage people in neighborhoods about how they would shape change in their neighborhood. So I showed a picture of the African Heritage Food Cooperative in Buffalo. That is an organization that came out of the east side of Buffalo. It is a Black-led food co-op that uses Black cooperative economic principles to drive the organization. So the risk of gentrification in that, zero. But if I were to now say, let's go put a grocery store owned by somebody else elsewhere, then we would be taking a higher risk. So yes, if you're not intentional and you're not thinking about process and who's driving it, you're going to fuel gentrification. Great question.
Thank you so much. That's very insightful.
So we're starting to get a lot more questions in the Q&A, and I think the first one that should be answered is by Leslie Hosfeld, who said, you address resiliency and make the case that the concept really focuses on the point that you deal with the problems that others create. What would be a better interpretation of resiliency, or rather, a better strategy for communities to respond in a resilient manner? Great reframing.
Yeah, that's a great question, Dean Hosfeld. One that I struggle with, because on the one hand, just to use basic, get the a definition out. Resilience means that when we come out of a crisis, we're in a better place than where we were. So in theory, nothing wrong with the word resilience. I think the struggle that I have, or insight that came in wake of COVID, was that the expectation of resilience from an outside entity upon a community, that's the problem. Because that's code word for you all fix it, even though we are creating the problem elsewhere. So I have, to be honest, I have not fully thought through what that is. Where my mind is right now is that we should be talking about equitable resilience. Haven't really fleshed it out. And in fact, our own community coalition called itself Seeding Resilience, as you saw on one of the slides. But we're okay with that because it's the community coalition that chose that collectively. I actually don't, maybe I don't know where the name came from. Maybe I came up with, which would make me really unhappy. But I would say equitable resilience, resilience that is driven by the community and is not foisted from an outside, is where we want to head.
Okay, so our next question comes from the chat, which states, thank you for a very stimulating presentation. I'm from Buffalo, New York, and so appreciate getting a deeper dive into the area dear to me. I agree with you that there needs to be intentional planning for food security. What do you think is the most powerful economic lever that can affect just and ethical food security efforts?
Hello, Kathleen. Come back to Buffalo. We miss you. Thanks for that question. You know, the data on this is still, at least the data that I have seen, is still emerging. And I have to say that the data that I have seen has come from outside of the United States. And one tool, economic tool, that I've really been watching carefully are cash transfer programs. So I am learning that direct cash transfer programs are efficient and effective in tackling food security. Whereas in the United States, the ways in which we develop food security responses are very much about let's move food itself. We eliminate choice, we eliminate agency. So I would say that I don't have the data clearly, but I'm studying or thinking more closely about cash transfer programs and how they have affected food security efforts outside of the United States.
Right, the next question is from the Q&A from Caitlin Dykeman. She asks, the problems around making food systems integral infrastructure are the same as those that the planning professions face with prioritizing green infrastructure, equating it with gray infrastructure in the development process. Would it be possible to link the two, since food systems, certainly the production side, is a form of green infrastructure? This would also begin to address issues of ecosystem resiliency, of environmental justice, etc. What are your thoughts?
Great question, Dr. Dickman. So glad to have you here, a fellow planner at Clemson. Yes, absolutely. I will say that I came to environmental work much later and really appreciated, in fact, several colleagues in Canada pointing out the really tight link between food infrastructure and green infrastructure. And so, I'm in agreement with you that they need to be in sync and not, there shouldn't be cross prioritization. But I do think that it's possible to do it together. And I'll give a quick example. I'm forgetting the name of the municipality immediately, but there's a municipality that gives some sort of a fiscal benefit to ranchers who use ecologically sensible practices. The water that enters their farm and leaves the farm, if it is cleaner when it leaves the farm, they get a benefit on their water bill. So that's a very small example, but I think that's unexplored. And I look forward to working with you to figure that one out more.
So our next question states, thank you so much. What is your assessment of the role of architecture and design in improving food security?
Great question. So not being an architect, I ask for your grace in my really bad answer probably. But I always think about, and I've learned that architecture and design really allows you to imagine possibilities that sometimes my engineering and planning head can't really fully fathom. So I think architecture and design has the possibility of tackling challenges in the food system that seem really intractable right now. Um, I don't have an immediate prescription, but really an invitation for colleagues that are doing architecture and design to help us really get at food systems work from their design thinking approach, because I think we might end up with solutions that we don't really think about. The one caution that I have is that I think that architecture and design thinking, like planning, has to emanate from the concerns of communities. It has to be rooted in questions of justice and ethics in order to turn that design process in service of communities. And then I think we'll end up with possibilities that I haven't thought about. I hope that's helpful, Susan.
So Mike McGurr in the Q&A asked, how has the presentation of this data to local governance and NGO leadership transformed into public organization of community-based approaches to food sovereignty compared to external interventions?
Great question. I don't think I have a full answer yet because I am unclear if the presentation of this data has fully transformed, has got us closer to food sovereignty. But I will say that I presume that Mike is referring to the data that I presented in my slides. I will say that one of the things that we are trying to do when the Food Lab, the team that I work with, and also colleagues, I noticed that perhaps Dr. Mui is on the webinar as well. When our colleagues learn what happens in communities, our tactic is to turn it into policy brief or guidance documents that local governments can then use. So we will develop short tools that local governments in the city of Buffalo or in other parts of the country can use. And one tool that I would point to is a database that the UB Food Lab maintains, which is a repository of all policies, well, not all, but quite a lot of food policies in the country that make the food system stronger. And I can tell you that that information is being used by local governments around the country. In my own city of Buffalo, I think some of the data has influenced passage of particular policies. So for example, we now have a food policy council that was established by law in the city of Buffalo and Erie County, but also across the country, provision of this data and bringing not just my data, but there are lots of colleagues across the country working on this, has shifted food governance. So I would say about 20 years ago, there were only a handful of food policy councils, but I think there are more than 300 food policy councils across the country. And I would say that their emergence is tied, again, not to my data, but generally to better data across the country around what is happening at the community level. I hope that's helpful.
Awesome. So our next question is, here in the North Atlanta area, children who qualify for free lunch but lived in more affluent areas were left behind at the beginning of the pandemic. These children were almost being punished for living too close to these affluent areas. The local community saw the need and stepped into action, building food pantries in their homes through their donations and delivering food to doorsteps. Overnight, the community was feeding hundreds of children. My question is, what suggestions do you have to keep the community involved after the pandemic is over? We are already seeing slower donations.
Congratulations, Marianne. It sounds like a fantastic effort in North Atlanta. You're absolutely right. It's tough to keep community engaged over time. This is something that the Buffalo Food Equity Network also thinks about. I certainly think about, our team thinks about, and which is why I encourage, this is a note to self as much as to the audience here, is to think about what are the systems we have to put in place so that those children are supported. So for example, in the city of Buffalo, there is a coalition that is trying to get the school district to recognize its role in the food system. It's called the Good Food Buffalo Coalition. So I might suggest that you and other leaders that have done such incredible work, which is an acute response to COVID, think about what are some systemic ways that you could offer some protections. So perhaps reach out to the school district, find out what they can do. Is there a food policy council there? Is there a coalition that can decide what are some system solutions that you want to put in place for the youth? And I do know that in Atlanta, there are lots of great groups that are doing that, not as familiar with what's going on in North Atlanta. But my suggestion would be, well, just an observation, it's not sustainable to do the kind of work that one did in an acute response time. We need kind of a systems change to continue to serve the kids well. So I would say definitely reach out to institutions and organizations that are set up for more systems change.
So the next question is again from the Q&A from Eugene. Thanks so much for your presentation. It was such an impressive storytelling about food system planning as an integral infrastructure supporting equitable, sustainable urban communities. My question is, I was wondering whether there have been significant changes in terms of the type of barriers or the size of barriers before and after COVID to local scale grassroots urban farming efforts among those economically and racially marginalized communities in Buffalo.
Great question, Eugene. I didn't have time to dive into all of the details about urban farming. I will say that in the city of Buffalo, we have lots of vacant lots that could be farmed, and we have functioning urban farms. I've lost the count, but there's definitely more than 5. And before COVID, there were challenges and barriers for urban farmers. And they include, among others, contamination, high cost of energy, lack of recognition about what they were doing, lots and lots of barriers. I think 2 things have happened after COVID. Because there is a recognition that urban farming is important, the attention to urban farming has gone up. And that's a positive. So more recognition. But the barrier that I think that continues to exist and perhaps has exacerbated is that even prior to COVID, we had 1 Black commercial farmer in the city of Buffalo, using an example. And it's still the same situation now after COVID. But I think that the resources that are available for Black farmers are being kind of pulled in different directions. So to be very plain, I would say that though attention to urban farming has gone up, I think that recognition of the inequity across race has not been tackled quite as clearly as it should be. But I am hopeful, I'm cautiously optimistic. In New York State, where Buffalo is located, there is a statewide effort to create a Black farmer fund that was led by Black farmers. And New York State, because of the farmers' organizing efforts, has established a group, a committee, you could say, the New York State Department of Ag and Markets, that is specifically asking the question that you are asking. That committee is meeting right now, so it's too early for me to tell whether it's going to be successful or not. But I think we are in a historic time. We can choose to create a totally different system, or this interest will taper off, and then future generations will look at us and say, what did you do post-COVID? So the answer to your question is not fully clear yet.
We have time for one more question. I'll turn that back over to Helen.
So our last question is from Catherine. She says, thank you for your talk, very interesting. What has been your experience with including community members facing challenges related to food access? I'm wondering if an asset-based framework could be used as a starting point for designing an equitably resilient food system that is starting with the community's strengths. Do you have a suggestion for encouraging genuine acceptance and inclusion of community members' involvement and voices in these efforts?
Great question, Catherine. Due to constraints of time, I did not mention, at least in our case, meaning my lab's case, UB Food Lab's case, we specifically use a model that is based on the idea of co-production, which means that researchers or anybody, practitioners, have to have a level playing field with their community partners, where community partners actually design what kind of a food system they want. So I gave the example of Freedom Gardens that was launched by Miss Gale. Miss Gale is from that neighborhood, and it was her idea to launch community gardens. The research team or the larger group's job was really to amplify that idea. So to be very clear, any of the ideas that I have talked about today, they all came from the community. And I would argue that that is the better way to go. And if you are in a research role or in a university role, I can play a better role by helping support those aspirations, certainly doing the evaluation and analysis and providing data back. But I think the idea that the assets and the solutions rest in the community is absolutely right on. That's really the success we are seeing in the city of Buffalo. I'll conclude with one example that you may wish to follow. This was pre-COVID. Two community organizations, our Black-led urban farm, Urban Fruits and Veggies, Massachusetts Avenue Project, Appetite for Change, which is actually in Minneapolis, not in Buffalo, and Buffalo Food Equity Network, together with a few faculty at UB, at Johns Hopkins, at University of Minnesota, collectively decided that we needed to build up community networks as a strategy for change on the east side of Buffalo. That idea for building community networks and using that to create an urban agriculture system and policy change completely came as a co-produced idea. So I guess I'm agreeing with you and supporting the idea of always beginning with looking at what the assets are in the community.
Thank you very much, Dr. Raja. I think you have engaged us all into some very high-level conversations. We certainly appreciate your time and volunteering, your expertise to our department. I will want to give a shout out to our change organization students, Helen and Sergio. I put in the chat box about the Rutland Institute for Ethics Student Committee change. I want to give them a quick thanks for their leadership. I also want to thank all the attendees today that have joined in this engaging conversation. Much more to come, I think, on this topic, and I hope that we can have Dr. Raja back again, maybe in real person in the future, and we can show her some of our agriculture and some of our infrastructure here at Clemson University as a land grant. I do want to remind everybody who is on this call that at 6:30, the Rutland Institute of Ethics will be hosting Dr. Bowen Matthew, Dean of George Washington Law School, for the TIDE Conference keynote address entitled Addressing the Ethical Implications of Racial Equalities in American Healthcare. The link for that Zoom meeting can be found on the same page where you found this Zoom link, clemson.edu/ethics/programs on the TIDE Conference page. Please do help us continue improving this conference by completing a feedback survey. Once the meeting ends, the URL for the feedback will pop up. It will take but just a minute, and we really do appreciate your feedback. If you would like to keep up with future events from the Rutland Institute of Ethics, you can follow us on Facebook, Twitter, and Instagram at Clemson Ethics. Thank you all for your time. You've been amazingly attentive. And Dr. Raja, thank you again for your expertise and your guidance on this particular topic. We appreciate it so very much.
Thank you very much. It was a pleasure.
Y'all have a great evening.